Hi, I am Dr. Bharath, resident in the Department of Emergency Medicine at All India Institute of Medical Sciences, New Delhi, India. Our quality improvement study focused on reducing door-to-reperfusion time in ST Elevation Myocardial Infarction patients. The co-authors of this study are Dr. Akshay Kumar, Dr. Praveen Aggarwal, Dr. Ashok Deorari, Dr. Sanjeev Bhoi, Dr. Balram Bhargava, and Dr. Sonali Vaid. We have no conflict of interest. All India Institute of Medical Sciences is one of the largest tertiary care government hospitals in the country. Our emergency department caters to more than 450 patients per day. Due to the large volume of cases, there was a delay in the treatment of ST Elevation Myocardial Infarction patients. ST Elevation Myocardial Infarction is a highly time-sensitive condition. Most of the international guidelines recommend that a patient presenting with ST elevation to the hospital should undergo reperfusion, that is, percutaneous coronary intervention within 90 minutes. The time from which the patient presents to the hospital to the time he receives coronary intervention is known as door-to-balloon time, and this time should be less than 90 minutes according to guidelines. The aim of our study was to increase the percentage of STEMI patients undergoing primary percutaneous coronary intervention with door-to-balloon time of less than 90 minutes by 30%. After obtaining Institutional Ethics Committee clearance, we started the project by forming a QI team. The team consisted of doctors, nursing staff, security guards, and health assistants. A few of the change ideas which were implemented in the study are described below. One of the first change ideas was focused group discussions. The discussions were done to create awareness regarding the care of STEMI patients. This reduced the door-to-ECG time from a baseline of 20 minutes to 13 minutes. We created a fast-track lane from the triage area to the resuscitation bay. This was first tested in one of the morning shifts when the patient load was less. This was then extrapolated to all the shifts. This reduced the average time to transfer from 10 minutes to 6 minutes. An induction program was organized to all the residents in the department. This focused on the emergency care. This led to a decrease in the door-to-cardiology communication time from a baseline of 35 minutes to less than 20 minutes. The induction program then was integrated into the departmental activities. Early interpretation of ECG by emergency department senior resident led to faster diagnosis of STEMI patients and therefore faster treatment. This is the run chart of our study. The orange line represents the median door-to-balloon time during the baseline phase of this study, which was about 122 minutes. The green line represents the goal, that is 90 minutes. As we can see here, there is a continuous change in the average door-to-balloon time, which has been sustained in the post-intervention phase also. During the initial phases of the study, only 22% of the patients had door-to-balloon time of less than 90 minutes. In a post-intervention phase, which lasted for about 4.5 months, 70% of the STEMI patients presenting to our emergency received coronary intervention within 90 minutes. That is, there was an increase of about 48% of patients with respect to our target, which was 30%. To conclude, quality improvement is a cultural change. The most important part in this is that all cadres of staff should be involved in the change. We included doctors, nursing staff, health assistants, and security guards. Involvement of the frontline workers was the most important factor which led to the success of this study. To have a sustainable improvement, we need to address both individual and system barriers. There has been a significant improvement in care of STEMI patients in our institute. Thank you.